Johnson & Johnson's single-shot COVID vaccines could resume as early as the weekend.
CDC advisors voted about an hour ago 10-4 to recommend the shots again for anyone 18 and older, but they are proposing a warning label be added. The vaccine had been put on pause since last week after rare reports of people developing rare blood clots. 15 people, all women, had been affected. 3 of those patients died. For context, though, nearly 7 million people had already gotten the shots before they were temporarily halted. Caitlin Ross explains why advisors believe the benefits outweigh the risks.
They were really talking about the risk-benefit analysis. There were dozens of presentations about what it would do to the vaccination rates if the one-shot dose was no longer available in the U.S. They actually ran a statistical analysis about the risks and benefits of resuming the J&J shot for everyone in the country. They found they would likely see 26 to 45 additional cases of that rare blood clotting disorder, but would likely see 3,500 fewer ICU admissions and 1,400 fewer deaths if people could still get it. During the public comment period, doctors who called in strongly recommended the U.S. resume the use of the vaccination to get more people immunized and cut down on vaccine hesitancy. The company itself made the case for resuming its use, with doctors for Janssen saying they're taking the rare cases seriously, but they believe the risks outweigh the benefits. The company said it would staff a 24-hour global hotline where people could call in if they started feeling side effects from the vaccination. They also said they would start labeling all the vaccinations with the possible side effects.
All right, Caitlin, thank you.